6:14 all new this morning. A major change from the White House to help make prescription drugs cheaper.
A lot of talk about this. The White House announcing the first group of drugs that could see price negotiations for those on Medicare. We do want to bring in our national political correspondent, Joe St. George, following this from our nation's capital. So what can you tell us about this so far?
Yeah, well, if you're an older American waking up with us having your coffee, we don't need to explain to you how pharmaceutical prices, the price of drugs, how Medicare Part D doesn't necessarily cover it all. It's certainly an impact for a big deal for millions of Americans. We have the list of drugs on screen. It's important to keep showing it because the question is always, well, how does this impact me? Will this impact my loved one, my mom, my dad, my husband or wife, my partner? This 10 list of drugs, including Eliquis on that list, used by millions of Americans, they account for around 20% of all costs that Medicare Part D covered in the last year. So that's why this list was selected. Obviously, this impacts a lot of people. As far as why this is taking place, remember, for years, Medicare was not allowed to negotiate the price of the prescription drugs with pharmaceutical companies. They essentially had to pay what they were told to pay. That changed with the Inflation Reduction Act. President Biden, obviously his team taking a victory lap today. They're going to hold a healthcare event at the White House saying why this is a big deal. But remember, this change isn't going to change your budget overnight. This is going to be a lengthy negotiation process with pharmaceutical companies, likely not until 2026. 2026 is when these savings would be passed along to you. And there's a chance, guys, that this would get blocked in the courts. The pharmaceutical companies have already filed lawsuits over this, some of them saying it's unconstitutional to tell a private company how much they can charge for something. And others have argued this will impact research and development of newer and better drugs because it ultimately impacts the profits that pharmaceutical companies have. But obviously a big deal here in Washington today with an impact for a lot of Arizonans.
Yeah, just looking at healthinsurance.org, Joe, about 20% of our state's population is on Medicare. So it's about 1.5 million people. It's a lot of people that this could potentially impact down the road, as you mentioned, not right away, but something so many people in Arizona are paying attention to.
And we appreciate your live report and your insight.